Hello everyone and welcome back to Medic Simple, where medical conditions are simplified. Today I'm going to advise you on what to do if you get shoulder pain. Hi, the aim of this video is to advise you on what to do when you get shoulder pain so that you can go back to your life safely and quickly. Please make sure you take any advice from this video in conjunction with your GP or specialist. So as you know, shoulder pain can be mild, moderate or severe, and can this either creep in bit by bit, daily, monthly and weekly from all the repetitive work you do every day in your job, on your daily activity, or can come suddenly and cause severe pain. The most important thing that when you develop the pain, that you should stop anything which make the pain worse. If you stop the pain cycle, this will give chance for your tendon or inflamed bursa or whatever causing the shoulder pain to heal up on its own. These are general principles. But if you're having a mild pain, which is what we say 2 to 3 out of 10, that you have any type of cream or ointment that you could get from the pharmacy, like ibuprofen, that will help you to relieve the pain and reduce the inflammation. You could also take over-counter pain medication. You could also start doing some stretching exercises that I usually recommend and advise my patient to do. So if you want to see if these exercises can help you, please make sure that you subscribe to my channel and hit the notification bell so you don't miss out on next videos. If after trying these simple measures of rubbing creams and taking over-the-counter medication didn't help with your pain, then please make sure that you see a specialist or your GP so that they can give you the advice on what to do next. But if your pain is moderate, say 3 to 6 out of 10, I would also advise to avoid any movement which initiate the pain. Don't forget that you need to break the pain cycle and also apply some topical creams or ointments, but you have to see your GP in that case, so they would prescribe you a bit of stronger medication, and they may also give you some exercise to do to help you to ease the shoulder pain. So if your pain is severe, make sure you stop any movement or any exercise that would initiate the pain. Don't forget you need to break the pain cycle. Apply some topical or local ointment, and make sure that you see your GP to have more powerful oral medications to help you with the pain. Or even better, your GP may suggest that you go for an ultrasound guided injection, where we inject specific and special medication to help shut the pain down. Taking over-the-counter medication for severe pain is not gonna really help you, because the pain is so severe that over-the-counter medication may not even touch the pain. I myself had severe shoulder pain, and this caused a lot of upset because it stopped me from doing the job that I like. And you may also have the same, and this may stop you and cause little similar upset. So make sure that you seek the right treatment for your condition. If you have over-counter medication for severe pain or moderate pain, it may not really help. You need to have the right treatment, which is ultrasound guided injection, which will help you with the pain instantly and will help you to get on with your life. Don't forget that having the injection will also help you to see a physiotherapy specialist who will give you a more specific exercises and do some shoulder movement to help gain your movement again. And it's important to say that some people would prefer to ignore the shoulder pain, and there's nothing wrong about this, because actually some type of shoulder pain can really resolve on its own without any medication. But the problem or the risk you're taking here is sometimes if the pain lasts for weeks or months, it can create a condition called adhesive capsulitis or frozen shoulder, where the envelope covering the shoulder joint gets thickened and inflamed, and this will cause friction and limitation of movement and may initiate your pain again. One of the other reasons I'm making this video as well is to not accept that it's okay to have shoulder pain. Shoulder pain can be really severe and can really affect your well-being, can affect how you deal with day-to-day activities. And I'm sure that you're watching this because either you've had pain or you know someone who's got pain. The main thing is really you need to ask for medical advice if shoulder pain is not getting better after a week of having your cream application and over-the-counter medication. So by now I hope that I managed to explain to you what to do when you've got shoulder pain, so that you can get on with your life and avoid it from stopping you from enjoying your day-to-day activities. But if you have any further question, please don't hesitate to write it below in the comment box. If you like this video and you found it helpful, please make sure that you like, share and subscribe, and hit the notification bell so that you don't miss out on my next videos. Thank you.